Think so? Okay.
I don't think there's.
Yeah, if it was Dr. Bell sitting here telling me that, I'd say, no, that's it. He done it. Where is it? I don't want I see it. Okay, there you go.
All right. I'll call the meeting to order and thank you all for being here. I know the weather was quite rough outside for some driving in. I know it was for me with hail and a lot of rain. I didn't see any valet parking out there. I didn't. Anyway, we'll have to work on that, I guess. But anyway, I'm gonna turn it over to Laura. Do a roll call, please. Laura.
Yes, sir. Laura Shu, I'm General Counsel for the Department of Health. I'm going to call the roll for the Board of Health meeting today. Dr. Gilmore.
Here.
Dr. Flamick.
Here.
Renee Mallory.
Present.
Kate Chandler. Here. Lloyd Bailey.
Here.
Robert Bonner.
Present.
Melly Bradwell.
Here.
Eddie Bryant.
Here. On the phone.
Thank you. Chris Cathy.
Here.
Lane Kreider. Lane Kreider. Dr. Daniels. Dwayne Daniels. Brad Ernie.
Present.
Vanessa Caldwell. Vanessa Caldwell. Justin Franks.
Here.
Anthony Floyd. Anthony Floyd. David Kiesling. David Kiesling. Alan Nair. Alan Nair. Donald Ragland.
Here.
Mike Riddell. Mike Riddell. Jim Terry.
Here.
Blake Torres.
Here.
Clay Williski.
Here virtually.
James Zini.
Here. Okay. Again, thank you all for participating here today and being here. And so you were sent the January 25th minutes to review. And I hope you had a chance to review those and such. And if I could have a motion to approve those, or if we need to make any changes or corrections or whatever, you want us to know that, please. Can I get a motion?
I move to approve.
Dr. Zane, thank you. Second. Are there any changes, discussion about those minutes in any way? All those in favor of approval of minutes, would you say aye?
Aye.
Those approved. Any old business that we need to talk about?
Hello?
Yeah, let's, mute mics that are on Zoom or on phone, please, because it's echoing in here. If you would please mute till you speak, that would help us. So let's move to new business, rules pertaining to land-based payment. Please mute your phones or your, if you're on Zoom, please put it on mute. Okay, Ashley? Zoom. Zoom. Ashley Mason?
You are not allowed to unmute. To raise your hand, press *5.
Just. Hey, you got it cut off on there? Can you mute those?
You are allowed to unmute. To unmute yourself,
I'm doing right now. I think you're good. Thank you. Go ahead, Ashley.
My name is Ashley Mason, and I'm with the lead-based paint program.
Do your mark.
Can everyone hear me? My name is Ashley Mason, and I'm with the lead-based paint program. Recently, the legislators passed that we needed to update our rules. We needed to add information. We had to add additional definitions that we would be, whenever we would get a military personnel application, that we would process it quickly, which we added in, but with our program, as soon as we get an application, we're processing it immediately. So it's great. We added it, but we process everything pretty quickly. Let's see. We have updated the rules. If you guys would like a copy of them, just let me know. But again, we just updated it based on what the legislators required us to.
Any questions for Ashley? Hope all of you had a chance to read that. It's pretty thorough.
It was only a few updates.
I know, but it's interesting.
Yeah.
The complication of all of that, living with that. So we need to have an approval of that. But I have a motion to. About a second. Second. All those in favor say aye.
Aye.
Any opposed? Thank you, Ashley. All right. Greg Smith, our attorney, repeal of rules and regulations on retired position community act.
Thank you, Dr. Gilmore. Chuck Thompson. Craig is going to handle the EMS, I think. Chuck Thompson, attorney, ADH. Members, appreciate you being out here today, especially in this weather. Wow. What y'all have before you is repeal the rules and regulations for Retired Physician Immunity Act. And what this is doing is actually repealing a rule that was already folded into our rules regarding volunteer immunity for physicians and those providing low cost medical services. So you have immunity sitting at 3 separate titles for some reason. I don't know why the legislature decided to do that. You have 3 separate titles spread throughout the code. So you have in Title 16, Title 17, and Title 20. So under those code sections, ADH has to do rules to help guide folks. So we took those rules, combined them into one, which you all approved in 2022 already. So for ease of reading, ease of finding, people understand where everything lay. So all this doing is repealing the old one that's been sitting out there. You can see Jim Guy Tucker actually signed this one. You see how old that's been sitting out there. So this is strictly a repeal, clean up. It comes that way. Everybody knows that that doesn't exist as a standalone anymore. It's in the other rules that y'all passed in 2022. I'd be happy to take any questions.
Any questions? Sure.
Make a motion.
Second. Second. All those in favor say aye. Aye. Any opposed? All right. Thank you.
Thank you, members. Thank you, Mr. Chair.
All right. Water Operator Licensing Committee appointments. Lance Jones, Director of Engineering.
Good morning, Lance Jones, Engineering Section, the Drinking Water Program. We have upcoming vacancy for one of the members on our Drinking Water Advisory and Operator Licensing Committee. And we've received 2 nominees for your consideration. This position is one of the licensed operator positions. And in your packet, we have nominations and letter of recommendation, along with the resumes for Mr. James Wisnut that was nominated by the Southern Arkansas University Tech Arkansas Environmental Training Academy, as well as the Arkansas Water Works and Water Environment Association. And Mr. Wisnut is the chief operator at the Texarkana Water Utilities. He's fully licensed at grade 4 for both treatment and distribution for water system operations. Also, Mr. Bruce Curtis from the Conway County Regional Water Distribution District was nominated by the Arkansas Rural Water Association. He is also fully licensed with the grade 4 treatment and distribution license and meets the requirements for nomination. At this time, if you take any questions or ask for a nomination for one of the individuals.
Any questions for me? Any comments? All right, so we need to approve those. We need a motion.
There's only one position available, so only one person. Can be nominated, yes.
So do you have a recommendation of these?
So traditionally, we don't, from staff, we don't make a recommendation on the nominees. We just qualify that they meet the requirements and utilize the nominations from the industry organizations that presented the nominations in the packet.
Well, let's have some discussion here.
I know a question. Where is the other 3 members located at this time?
The other 3 operators, one is from Kinsey Water District, which is down in the around Lake DeGray. It's also operator from the Central Arkansas Water System here in Central Arkansas, and then also manager from the Grand Prairie Regional Water District over South London. So the outgoing member is from Fort Smith Utilities.
Okay, thanks.
What do y'all think?
Thank you. Got one already close to Mr. Wisnut. Second. I'd like to nominate Mr. Curtis. I know neither one of them.
Just something I think one or both of the nominees are here. If anybody has any questions for them individually, that might be something you may want to be interested in.
You said that they are here.
At least one, I'm not sure.
Who's here? Who's here?
Mr. Chris, both are here.
Would y'all like to hear a comment from each one of them? Let's do that. Why don't you introduce each one? Give them a few minutes. Take 2 or 3 minutes. Share about themselves.
Okay. Let's go in the order that we got them presented here. So Mr. Wizenhut was the first one on the list.
My name's James Wizenhut.
Come to the mic.
They can't hear you.
Business, I understand. Good morning, everyone. My name is James Wizenhut. I am from Texarkana Water Utilities. I've been the chief operator there since 2018. I've been working for them since 2012. I've been in the water business ever since I got out of high school, 2008. Prior to that, I used to work at a water plant with my dad on weekends and summertime help. So I've been in the business for almost 20 years. Officially on paper, I've got 15 years experience. I do hold the highest licenses in the state of Arkansas as well as the state of Texas. I've run both water plants on Texas and Arkansas side of Texarkana Water. Currently, like I said, Mr. Jones said, I'm running the water plant there in Ashdown for Texarkana Water Utilities. If there's any questions y'all like to ask of me, I'll answer anything you need me to. Okay.
Good morning. Thank you for that description. Why are you seeking this nomination?
South Arkansas hasn't been represented for some time. I was encouraged by several of my peers and some of the elderly gentlemen in my region that have sat on this committee once before that you know, they sort of encouraged me to represent South Arkansas to this committee. Currently, I'm the Southwest District Director of the Arkansas Waterworks Water Environmental Association. So I kind of stepped into that role back in 2015. 2015 I was officer, but 2020 I stepped into the role as the district director. And so with the appointment of Arkansas Waterworks nominating me and Arkansas Environmental Training Academy from Magnolia, they felt that I would fairly represent the South as part of the state.
Thank you.
Any other questions or comments? Thank you, sir.
I thank you for your time.
Mr. Curtis, could you come to the podium?
Good morning. My name is Bruce Curtis. I'm from Columbia Regional Water. Been working in the water business since 2006. I've done everything from read meters to operate the treatment plant, all the way through installation, distribution. If it's done at our organization, I've done it all. I was asked by my boss if I'd be interested in being on the committee, which is how I came to be here. I know that's not very detailed, but that roughly covers everything that I've done. So I'll keep it brief. Any questions? Thank you for your time.
Thanks, Mr. Curtis. Further discussion, comments here? Someone want to make a motion?
Yeah, I'd make a motion for Wisenhut. I find the regional representation argument compelling. That and the experience.
So we have a motion and a second. All those in favor say aye. Aye. Opposed? All right. Congratulations.
Thank you. Mr. Chairman,
Yes,
we'd like to say to the other gentleman, thank you for applying. And with your experience, maybe you'll have an opportunity to come back sometime.
very good. Thank you. Thank you again. County Health Officers appointments.
Good morning, board members. I'm here to ask for your approval of 3 new county health officer appointments. But before I do that, let me be certain I don't forget. You all know that we normally hold Board of Health educational sessions in January and July of each year, following your board meetings. In the past, we used to do more of a weekend or getaway type of thing for the board. And I know recently there've been some discussion and request that we maybe entertain doing something similar again for the Board of Health. In discussions at the Health Department with Secretary Mallory and others, we've decided what we're going to do is try combining the educational session of the Board of Health with the county health officers. We have an annual county health officer symposium that we hold the first week of October usually. And it's a great weekend. All our county health officers, most of them attend. And we have sessions on various aspects of public health and the health department. And it's always felt by the county health officers to be very educational. And it also provides an opportunity for everybody to get to know each other and have dinner and breakfast and lunch together and really enjoy each other's company. So we would like to invite you all, and I'll send a save a date later this week to all of you to hold that day. That's the weekend of October 4th, 5th, and 6th. Usually starts in the evening with dinner and a keynote talk. And then we have sessions through lunchtime on Sunday. So we would love to welcome you all to join us with that.
Dr. Zachary, Dr. Zadie, since he fits both roles, may want to talk about, just say what you think about the county health officer meeting and how it might help the Board of Health members.
Well, thank you.
You're welcome.
I've been a county health officer for many years. I can't tell you exactly how long. And it is a great educational experience. It is as a county health officer, you are a spokesperson for the Department of Health actually in your county. And I can tell you with the recent COVID experiences I've had, it can become very demanding. Knowledge is very helpful. As you know, it was a contentious process. There are still folks who are still not convinced that COVID was as serious as it has become, and we still are seeing it. It is an opportunity to share experiences, but also to have good CME and become an expert actually in diseases and processes that affect the public health. And my passion has always been community health and public health. And I think that it really helped our board members, all of our board members, to see another extension of the Department of Health that you probably don't think about on an everyday basis. We work very closely with our county health offices and our county nurses in the school districts. I think county health officers are a very important part of the Department of Health, and it can be very helpful, I think, for board members as well as active county health officers to interface and pull together and learn from each other. I think it would be a win-win for us all. We encourage you all to please try to come.
Thank you.
I'll
send you a check later.
And you do it next week. And we would like to have service to get us through the rain and into the building in the future.
Thank you very much for that endorsement. So I'm here to ask for your approval of 3 county health officers for Deshae, Montgomery, and Cleburne counties. These are all new appointments. For Deshae County, we have the nomination of Dr. Jamie Evans of McGee. He'll be serving the remaining term of Dr. Young, James Young, who was a long-time county health officer and has served the state wonderfully for many years. He passed away in November of last year. Dr. Evans is currently a family medicine physician with the main bank health systems in Dermot. He's also a hospital at McGee Hospital. He's licensed in Arkansas, Alabama, and Oklahoma. And also serves as the DeShay County coroner for DeShay County. He got his medical degree at the College of Medicine at the University of Oklahoma Health Sciences Center, and then did a preventive medicine residency at the same institution. He's also a member of the American Academy of Family Physicians and the Arkansas Medical Society. Would you like me to go through all three of them, or approve, or one at a time? Okay, all right. Montgomery County, we have the nomination of Dr. Joshua Lindsay, and you have the letters from the county judge and also the interim administrator of the local health unit there. Dr. Lindsay replaces Dr. Knight Verser, who has leave moved out of the county. He is currently employed with CHI St. Vincent in Mount Ida. He did his medical training at UMS in Little Rock and also family medicine residency program at Jonesboro with UMS. And then third, we have nomination of Dr. Granville Vaughn for Cleveland County, who replaces Dr. Matthew Wagner, who resigned and moved out of the county. Dr. Wagner is the nomination letter say that he has a lot of experience in serving the community and especially has a passion for public health. He also did his training at UMS. And is the medical director for the Cleveland County Detention Center. Currently serves as a physician medical doctor with the Family Medical Center Clinic in Beaver Springs. So I ask for your approval of these three new county health officers, please.
Any questions or comments on the presentation or any of these? Motion?
I move for approval.
Second.
All in favor, say aye.
Aye.
Any opposed? Very good. Thank you, sir.
Thank you very much.
What were the dates of that conference coming up? Yeah.
It's October 4th, 5th, and 6th, Friday evening through Sunday afternoon. But I will send a save the date to all the board members.
Okay, the next is Craig Smith, attorney on emergency medical services, administrative hearings. And I'll just say this, for those that participate in these hearings, I commend you for taking the time to do that. Dr. Fleming, I know it's been very involved in that. So thank you for being diligent in doing that. It means a lot. And there's lots of issues that come up in these and such. I participated in those earlier on some time ago, but it takes a lot of your time. Thank you for doing it. And the others that participate. Go ahead, Mr.
President, Craig Smith, attorney for the department. I want to reiterate our gratitude as well for those that serve on this subcommittees, Dr. Fleming, Dr. Ernie, and Dr. Dell, who's absent today. Today we have three hearings to present for your review. The first of which is Chris Falcone. So I'll confirm if he is online or in the hallway. All right. Excuse me, Mr. Falcone was arrested in 2021. There was a conviction that was resulted in 2023. Pursuant to his arrest, he went through a process for probation and suspension and then probation with the department of his license. And this was before a conviction on those charges was made last year. So Mr. Buckhorn has gone through a process with our department for rehabilitation for these drug-related convictions. And however, because of the charges that, because of the conviction at the end of last year, that his license is subject to a disqualifying offense under Arkansas law. Arkansas law provides that he may be given a waiver, and that waiver would be granted by the Department of Review by Secretary Mallory. In order to provide that he has an opportunity to present that waiver, we propose to give him 30 days to complete that from the date of the hearing that we had on April 3rd. And so he was working on that process to submit that application. And so we're asking that his license be placed on probation until that waiver application has gone through, either is granted or denied.
Good.
Just you could educate me a little bit on the meaning of probation versus suspension. What exactly is the status? Will he have the abilities to administer services during this period?
Yes, during probation, he is allowed to work. But if there are any other offenses that arise during that period, then he is subject to revocation of his license.
Any other questions?
What was the timeline, 30 days starting when?
April 3rd.
April 3rd.
So he will have until May 3rd to complete his packet for the waiver application, and then his probation will continue until a determination has been made on that waiver.
So Craig, in these hearings, you have three people that you just mentioned a minute ago. Is there administrative law person there as well too?
There's a hearing officer that conducts the hearing, but the ultimate decision falls on this board.
Right, but it's pretty formal all the way through.
Correct.
Sometimes they have attorneys with them and those sorts of things representing them, so it's pretty thorough. So any other comments from anyone about this particular one? We'll need a motion to approve this, or if there's any proposed changes or anything you'd want to make to that.
Make a motion that we approve it.
Second, Ernie.
All in favor, say aye.
Aye.
Any opposed? None? Good. This next one is which?
The next one is Mario Ramos, and I will confirm if he is online or not in the hallway and not online. And I will note for all of these three individuals, they were given notice at today's board meetings that they can appear and present any comments on their behalf. Mr. Ramos was working at a EMS service in Centerton. The service provided a random drug test screen for all employees. It resulted in a positive drug screen for marijuana. He was terminated from that service. And so during the administrative hearing conducting with Mr. Ramos, the subcommittee is proposing that, and I apologize, at the time that we were notified of his termination, he was placed on emergency suspension of his license, so he's not been working since that time. The subcommittee is proposing that we ask Mr. Ramos to go through the similar process that we have for other first-time offenders, a period of suspension, starting from the date of the hearing. For this one is 3 months. After that period is completed, he will have 12 months of probation. During this time, he will be subject to requirements for continuing education, random drug screenings, and evaluation by a medical professional for fitness to serve.
Questions, comments? Motion? Dr. Hoyer, move forward. recommended, what the group recommended. There's
I second it.
all in favor, say aye.
Aye.
Any opposed? What was that? Okay.
All right, our final one is Mr. Michael Brown, and I will confirm that he's not online and not hallway. Earlier this year, Mr. Brown was arrested for diversion of narcotics, specifically morphine, terminated from his service, and he has been charged with acquiring narcotics through misrepresentation of fraud. Because those charges are pending, the department placed him on emergency suspension. And in order to provide whether or not he will, his license will be suspended or revoked, it is our process to wait until those charges have been adjudicated. And so we are requesting that his suspension be continued until those charges are properly adjudicated. If he is convicted, then those charges would be a disqualifying offense under Arkansas law. And so maybe preventing from having his license back at that time. However, we need to wait for the process to go through.
Any questions or concerns on this one? And you have the subcommittee's report there. Do you have a motion to approve or?
I move to approve.
Second. All those in favor say aye.
Aye.
Any opposed? There you have it.
Thank you, members.
Okay, I know we moved sort of rapidly here and we have other business, administrative update, Don Allen, chief staff.
Good morning, Mr. Chair, fellow board members. Appreciate the opportunity to talk about a riveting subject I know you're excited about, which is our organizational chart. Yes, Mike, can you pull it up? I'm not sure how well you're going to be able to see this. We've made some recent changes and we felt it was appropriate for us to update the board on what these changes are. They're fairly minor, mainly name changes. So the first change I want to talk about is the name change of our primary subunits. And I don't have a pointer, but at the bottom of the org chart, the bottom half, you see 4 what we used to refer to as centers. And that name came back, that nomenclature was used back, I believe about 20 years ago under Dr. Paul Haverson. Our primary subunits were divided into centers. I think this models after the federal DHHS, like Centers for Disease Control and Prevention, Center for Medicaid, Medicare. But that is unique to our department within state government. I believe it doesn't resonate well with the public, and other state agencies use the subdivision term of division. So we are changing the name of our centers to divisions. So I wanted to highlight that change. And let me just briefly talk about the 5 primary divisions that we have. We have the Division of Health Protection, which is on your far left. Mike's pointing to it there. Thank you. The Division of Local Public Health. That's our local health units and the service arm of our department. We have the, I'm not sure what the next one is. Is it Data and Analytics?
Health data and analytics.
Okay, that division we also wanted to highlight, that used to be called the Center for Public Health Practice, and we changed the name to the Division of Health Data and Analytics, which we think is more descriptive of what that division does. We have the Glenn F. Baker Public Health Lab. It's not titled a division, but in all practical purposes, it functions like a division. And then we have the Division of Health Advancement. So those are the 5 primary, thank you, subdivisions that we have within the department. Each division has what we used to call center director. Now we call them division directors, and 2 associate directors. 1 associate director for administration, and one associate director for science. And under each division, we have what we call branches. If you can see those on the org chart, there are several branches underneath each division. And then to further go down, we have sections and programs underneath those branches. So just wanted to update you on those changes, those name changes from centers to divisions, and then the change from practice to data and analytics and some title changes. So if you have any questions, I'll be glad to answer.
Any questions of Don? Thank you very much.
Thank you.
Okay, we're going to move down to public health science programs updates or further remarks. Any of those?
Yes.
I am under secretary.
And so I'm going to defer my time to Secretary Brown.
Okay, so if y'all been watching the news and other things, y'all know that we had an executive order that was signed March 6th to support moms, protect babies, and improve maternal health. And we've not been doing much since then except maternal health. So, you know, what it was for, it established and I'm going to read to you for just a sec, established the Arkansas Strategic Committee for Maternal Health that will engage with legislators, advocacy organizations, healthcare providers, and other stakeholders in a maternal health working group to provide input and support the development of a statewide strategic maternal health plan. And I think, you know, if you have watched the news, y'all know that with maternal mortality, depending on which report you look at, we're at the bottom. So we're either 45 to 50 with whichever one you look at. And I know Dr. Greenfield's in the audience. He can talk about this a lot better than I can, you know, because he heads up our maternal mortality committee. But what was happening is because of all the media attention, there was a lot of groups in Arkansas doing a lot of different things. And it was hard to keep up with who was doing what, because, you know, there was a lot of stakeholders that sat on, you know, the same meetings, but it seemed like everybody wasn't together on what they were doing. Some were duplicating work, some were going off in different directions. So I think, you know, when the governor started getting interested in it, she realized that there really wasn't anybody that was coordinating anything with it. So you know, she got a group, she got the Secretary of Education, Secretary of Me, Secretary of Health, Secretary of the Department of Human Services, and said, what can we do? So I think with those conversations, there was a lot of things that came out that we really, and one of those was we really didn't have the data to tell us, other than maternal mortality, where we were at. You know, with Medicaid, you know, Medicaid has a lot of the births in Arkansas, pays for a lot of the births, but they do a bundled payment. So there really wasn't anything to say before that baby was born, what happened to that mom during that time of prenatal care. So when we started looking at that and realized we didn't have anything to kind of tell us what was happening, you know, luckily we have Dr. Porter, who started looking at what we could get, and what he found was we did have some data on prenatal care. And what it was is when a mom, when that baby is born and there's that initial birth certificate, there's some questions that has to be completed on that to get that birth certificate. And some of it has to do with prenatal care and when the mom started getting prenatal care. So when we started looking at those numbers, when Austin ran those numbers for us, you know, it was pitiful. I mean, because we had a lot of moms. If you heard the announcement, there was over 10,000 moms either getting prenatal care in the third trimester are not getting prenatal care at all. So when we started looking at that, it was like, and there's a lot I didn't say. So the 4 goals outlined in the EO is improve education regarding women's and maternal health, improve maternal health before, during, and after pregnancy, increase access to quality maternal health services, and improve statewide coordination. So, but for the health department part, when we started looking, it's like, what can we do? And when we looked at those the causes for maternal death, it was, a lot of it is around women being unhealthy to begin with. You know, it's hypertensive disorders, it's cardiomyopathy, it's cerebrovascular disease. So, you know, we're in an unhealthy state. I don't have to tell you all that. And so to make to do something with that in a quick way, there's no way. I mean, there's a lot of things that enter into that, you know, we're going to have to take care of to make a healthy mom before she enters pregnancy. But that is a goal. You know, we want to look at that. But looking at what the department could do about those prenatal numbers, you know, when we first started looking, it's like, it's overwhelming. But if you look at the numbers, of course, you know, the worst numbers are in the Delta. You know, there's no doubt when you look at those numbers. But we didn't want to focus just on the Delta, but we needed to take a small bite at a time and try to figure out what works and what doesn't work. So what we did is we had from a statewide level, we knew we needed to get stakeholders in a room and identify where the gaps are. You know, what are the gaps? What can we do about those gaps from a statewide perspective? Where are the stakeholders? Who are they that can do something about those gaps? And how do we do that? We actually had that big meeting on Monday of this week. So we had probably 150 people in a room. We divided up into 4 groups depending on what the area. There was education, there was data, there was the clinical piece and the Medicaid piece. So everybody, you know, from whatever perspective they were coming from, got in a group and tried to identify what are the gaps, what can we do, and what can we do about it. So then, but from a local standpoint, what can we as the department do? Because we, you know, have those health units in every county where we actually do clinical services. In some of those counties, we do maternity services. So in what our role is, we don't want to compete with private docs in any county that we have. But if we know that there are, if there's lack of care in a certain area in those counties, then we want to try to fill that gap. And so we do maternity services in some of our counties where there's either no services available or there's a lack of services available, especially for a woman, a pregnant mom that doesn't have insurance. So what we want to do is get those moms into us, get them started on prenatal care, try to get them on Medicaid if that's appropriate, and then pass them off to a person that's going to deliver that, to do the rest of the prenatal care and deliver that baby. Now, in some counties, that's very difficult. There's not an OB in some counties. So you know, we're trying to, you know, identify what we can do in those counties. But so what we did to try to take a small bite and do it statewide is we, in our 5 local public health regions, we picked the county that had the worst prenatal numbers. So what that boiled down to was Scott, Polk, Crittenden, Phillips, and Garland. And so what we wanted to do in those counties, we went to all 5 counties, we met with our local staff and, you know, try to streamline our process and make sure that we're following the same process with our maternal patients and getting them signed up to our services immediately when they first present to us. But what we also are trying to do is at a more local level, do the same thing locally that we did with that big stakeholder meeting on Monday. And that's get the stakeholders together in those counties, identify who they are, where our gaps are, where they can fill those gaps, and where we may have to bring some kind of state services in to try to see what we can do about filling those gaps. But we, the strategic committee, and I should have said this to begin with, is made up of the Secretary of Health, Secretary of Department of Human Services, Secretary of Education, Dr. Greenfield, with his maternal mortality role, the Surgeon General, Dr. Chandler, who is on, the Deputy Director of Programs for Us, Casey Cochran, and the Deputy Director at DHS, which is Janet Mann. So we make up that strategic committee. But then, so our first meeting locally is today in Garland County. It will take place this afternoon. So, with all of the people at the table, we're going to try to get the prenatal numbers in those counties better. So if y'all have any influence on that, we're looking for help. And at the same time, Dr. Porter is heading up the group that's looking at the data and the how we get that data to really tell us if we are where's gaps in our data, and then how do we tell if we're making a difference. Casey, it looks like by default, is heading up the education piece of that subgroup that broke out, and then Dr. Greenfield is heading up the clinical piece. So I would ask, I know Dr. Chandler's on, Dr. Greenfield's here, Casey's here, so if anybody wants to elaborate or give comments on where I've left off, please feel free to do so. Dr. Greenfield, you always want to say something.
Well, no. I was just gonna stand in the line of fire. So we have had the maternal mortality review committee, which has driven the conversation for the past several years. And now the activity within the state is broad. A few years ago, we would do a presentation, we would talk about 2 or 3 things aspirationally that we would like to do. And now the list is actually too long to list in one reasonable setting. The efforts with the stakeholder meeting today, one of the things that I think we discovered when we've gone around the state is that each region, each county that we've approached has had a unique set of challenges. And these are things that we just simply can't get if we don't go there. Nor do you get the same people in the room, because if we have county health officers, which is the trusted liaison within the community and our local health unit, we may not necessarily get the private physicians, nor will we get folks who may have an interest in commerce or the local chamber. But collectively is the problem, and the functions within the local health unit have been dynamic in terms of some of the services we may have backed away from a few years ago. When the physician makeup of that community changes, the need may be established for us to have a more visible presence. And so these are the things that we are trying to address. So I won't speak long, but I'll certainly entertain any questions that we may have about the referral status within our state.
Well, I see Dr. Chandler. So do you want to say something, Kay?
Well, I've got laryngitis. I think I'll hold off. Sorry about that.
Dr. Fleming?
In my practice, I see pregnant up to 20 weeks in the ER. One of the biggest things we see is getting enrolled in Medicaid. That's usually the overwhelming excuse why they don't have prenatal care, why they're in the ER for either complication or sometimes even to find out they're pregnant. Is there something being done to educate the public on how to get enrolled in Medicaid or how to facilitate that?
So that's a hard one. We are going to have a media campaign, and we hear that about Medicaid all the time. Our folks actually fuss about that too. What we've learned is through this process that Medicaid application is 37 pages long. And we actually had a physician sit in a meeting and say she and her husband were trying to get a family member on Medicaid, and they had to have help. So it is a very difficult process. Now, what DHS has promised us thus far is to actually have a person on our maternity days in our local health units, to actually have a person to start the process with those women when they're in our health units. So that's a start. You know, that's not going to help everybody with Medicaid, but hopefully that'll help with some of the moms that don't know how, you know, and don't get an answer when they call Medicaid and don't get a lot of customer service. So we're holding them to that. So, you know, hopefully we can start the process, and then at least they can have a person, they know who to call when they, you know, because they're going to have to go home. They're not going to have all the paperwork and everything else they need, you know, when they come into us. But at least if we can get them started on that process, then hopefully we've at least done something.
I've heard over and over, it's difficult to do. People get frustrated with the process and then they just kind of give up. We do have some private OB doctors that are, their office staff are really good about helping them getting enrolled.
Yes.
But that's not everybody.
It's
So the
not.
people that out there left trying to figure out how to do it on their own, it's very difficult for some of them to do. And I see it just over and over back in the ER and sometimes complicated pregnancies where they really need obstetrician to be taking care of them.
Right.
Instead of coming to the ER every time something comes up.
We're trying, or we're going to try. It's starting.
I have a question. What does DHS actually do other than hand them 37 pages? Do they have anyone that helps them through the process? Is that a possibility where there's a need?
So that is definitely a need. I think we're trying to look at that, what that process is. And I think DHS is trying to, you know, look at what that process is. I think there were navigators years ago that I think we even, you know, we had some that we could send people to, or, you know, help with that. They did away with those. I think they're probably going to see that they need those people trained again to help. Where that's going to end up, I don't know, but we are trying to say there's issues there, and we're not, until we solve some of those issues, we're not going to make a difference. I mean, that's a big piece of this.
Is DHS involved in this whole process of trying to help the different mortality issues?
So the Secretary of Health, the Secretary of Human Services is part of the Strategic Committee. Janet Mann is actually, you know, their deputy director, and she's indirectly over Medicaid. That's a part of what, and she knows Medicaid backwards and forwards. So Christy and I, Secretary Putnam and I are very close. We work very well together. And I really do think that we have a better opportunity right now to get some things accomplished than we've ever had.
Just a quick question. I'm aware that there's some entities that are leveraging the community health workers. They're kind of a navigator position for a lot of different things. And I think maybe UAMS, maybe not be accurate on that, but I believe UAMS is looking to leverage community health workers to assist in this particular instance, some of the efforts that they're doing. And I believe the University of Northwest is leveraging, they have a view, they're leveraging along the same lines. So you can get that educational component, regardless of the language. Many encounter of networks. So I don't know, again, I don't know if that's an element of the discussion or not.
It is, Lloyd. Community health workers and doulas, depending on, you know, which term you use. They're not just alike, but they're a lot alike. And we're looking at the educational piece, you know, will there be legislation to certify them? And if there's a certification, you know, hopefully Medicaid would pay for a community health worker, you know, because, Dr. Greenfield can talk about this a lot better than I can, but there's better outcomes for a woman with some kind of support. Is that, is that a family member? Great, yes. I mean, we want the family in there, but they've also got to have somebody that can help them with some of these other things during pregnancy.
Statistically, what is the age group of the majority of the mortality issues with age?
Dr. Mayfield,
Pregnancies or?
this is his area, let me tell you.
I'll start by saying, we've drawn a lot of attention on, we've drawn a lot of attention to maternal mortality. I never really want to overstate that overwhelmingly our health system is safe. But we have brought attention to this. To answer your question specifically, the age group, women who are overage nationally and within our state, our maternal mortality rate is highest among women who are over the age of 35. That's number one. If you were to say, if we were to break down a pregnancy-related ratio and what groups are impacted, the number is almost about 2 times the rate for African-American women as compared to non-Hispanic white women within the state. We have about 35 to 38,000 births. Our ratio, 30,000 live births within the state, our ratio, when we break down the numbers, we say the number of deaths per 100,000, so we can do a comparison within our state to, say, a state like Texas, which will have, balance of multiple a lot higher. So there's a disparity that exists within demographic groups. There is a disparity that exists within age groups. And then if you just simply Google the MMRC fact sheet, we were able to break down the numbers per 100,000 based on public health region to see which regions within the state had the highest rates as well.
It'd probably be good for us to get a link out to them, to our maternal mortality report, plus that sheet, that one page.
We can do that, and I think I'm gonna have the opportunity within the next few weeks to give some presentations to members of the Board of Health. Maybe those county health officers, I'm sorry. But we can share that link and that information with you.
Are there any efforts within the public education system, that far as high school health classes and all? I know there's a big push for anti-drug, anti-smoking, alcohol. That is there that same push in our public education?
So Secretary Oliva is on our strategic group, and we're starting to have conversations about what we need to do in the schools. What we want to do first is these students. We've got a breakdown by county of the schools, the high schools that had pregnant students in those high schools. First, we want to identify those kids and those moms and get them into care, and then figure out what we need to do with other students going forward. That he is a member of that group, and that he is open to doing what we need to do in the schools to educate.
First, let me say thank you all. I know this is a monumental endeavor to try to move the needle, so I commend you all. And I almost reserve in making this comment because it comes across maybe selfishly. But I would ask or recommend that y'all consider pharmacy in y'all's stakeholder meetings and opportunity. I want to say we're here for y'all when needed. It worries me, or it's interesting when you reference third trimester. If I understand you correctly, it was the first time they maybe sought out care. And I think how many interactions they had with their pharmacy team at the counter, probably at least 6 or 8 in that time frame. So we're here for you guys, whether it's education or initial screening, for a referral to their OP or local health unit, whatever y'all need. So thanks y'all.
I I can reassure you that Dr. Marlene Battle was present at the clinical meeting and as representing pharmacy. And we've had a long-standing working relationship on this topic, so.
Yeah, Marlene is amazing. We have the perfect person there, so. Thank you.
Well, this has been very productive. Thank you for your remarks, your input, and serving in the way you are for the Department of Health being a major part of the strategic plan. These are our future children. So, any other comments or questions? Yes. We'll hear more about this in coming meetings, I'm sure.
For sure.
Okay. So, any other business? Motion to adjourn?
So moved.
All right. All right. We're adjourned. Thank you, guys. Thanks everybody for being here.